Welcome to episode 21 of the Cancer Pod. On today's episode, we're talking about omega-3 fatty acids. They're essential nutrients, but how essential are they in cancer care? Stick around for today's discussion. Supplements 101, omega-3 fatty acids.
I'm Dr. Tina Kaiser, and my favorite source of omega-3s is a nice piece of salmon.
And I'm Dr. Leah Sherman, and my favorite source of omega-3s are sardines.
And we're two naturopathic doctors who practice integrative cancer care.
But we're not your doctors.
This is for education, entertainment, and informational purposes only.
Do not apply any of this information without first speaking to your doctor.
The views and opinions expressed on this podcast by the host and their guests are solely their own.
Welcome to the Cancer Pod. Hey, Tina.
Hey, Leah. Are you all done with that oatmeal? You all well fed?
I am. It was delicious, except I realized that I forgot to add my ground flaxseed.
Well, how appropriate.
Right, because we're talking about omega-3 fatty acids.
And you just missed your first morning dose.
I did. I'll go back. I'll add it to something else. So, this is it's our second episode in the Supplements 101 pod. And it's the first one where we're actually talking about an actual supplement. So what we're going to do in this episode is we're going to talk about what are omega-3 fatty acids. They are essential nutrients. So why are they essential? Where do you get them? You and I are very big proponents of food first. So where do you get them in your diet? I don't like fish. Where am I going to get them? People ask, all the time. What are the specific benefits for cancer patients and cancer survivors? And then in terms of supplements, are there any contraindications as to when someone should not take them? Anything else? Are we going to talk about anything? Well, we might talk about other stuff too.
Who knows what tangents we'll go on today?
All right. So Tina, what is an essential nutrient?
Starting with the word essential, it really is literal. These fatty acids are essential to consume in your diet because your cells require them, your systems require these fatty acids, but you cannot create them from any other fatty acids. So a lot of times we'll take in a fat and we can convert it and we can use enzymes and we can snip it here, we can saturate it there, we can do all sorts of fun stuff with these fats that we consume and make what we need. The omega-3 fatty acids, we cannot make them. We have to take them in through a food source, and they are required for function. So the word essential, let's start there. It's an essential fatty acid or essential oils. No, essential oils are something different.
I'm not using my omega-3s as essential oils. I don't want to smell like a fish.
Essential oils are completely different. Essential oils are from plants, and they're the scented aspect of the plant. So not that. Essential fatty acids, not essential oils.
So what's kind of interesting to me is your body can make EPA and DHA, right? You can take in from plants the alpha-linolenic acid, and then through these enzymes, your body can convert that into EPA and DHA.
Right.
Because that's where the food source is, right? That's where the fish get it from. And, it's in eggs, right? You buy these high DHA eggs, and it's because those chickens they were fed flax, probably flax seeds, and then their little bodies converted it, and then they pooped it out into an egg.
Yes. So it always starts with plants, whether it's alpha-linolenic acid or it's linoleic acid. It starts from a plant. A plant has to make it, and then an animal consumes it.
So that might be a little confusing because I remember when I was first learning about this, ALA is alpha-linolenic acid, and that's omega-3.
Mm-hmm.
And then linoleic acid is omega-6.
Yes.
And so they both come from plants.
And they're both essential.
They're both essential. Yeah. And there is a ratio that is ideal of omega-6 to omega-3. And so ideally in our diet, we should be having like a 3 or a 4-to-1 ratio of 6 to 3. And what actually is happening with more Western diet is the ratio is more of 12 to 1.
Right.
So people are getting a lot more of the omega-6. And so finding ways of ramping up that omega-3 in your diet is really important because of what we use omega-3 fatty acids for, the processes in our body.
Right. And on the flip side, and I think this is the last we're going to mention, the omega-6 side of the equation, a lot of people are getting those omega-6 fatty acids from soybean oil, safflower, sunflower, vegetable oils. Basically, when you do the oil, cook with it, eat processed food that has it, that's what ups the omega-6 consumption.
Right. So would you say like a double-edged sword? Like it's a good thing, but it's also it could be a bad thing because of the fact that it is in a lot of processed foods. So they're not necessarily getting the good sources of omega-6, like the nuts and the seeds. They're getting them from those oils.
Right. Instead of the whole food, which limits your consumption of it.
Right.
Right. So we're not advocates of the vegetable oils in general.
Oh, I want to say a couple more cool things about at least the alpha-linolenic acid, the ALA. It's kind of neat that, it does convert in our bodies to the EPA and DHA.
Mm-hmm. Have we mentioned what the EPA and DHA stand for?
No, because it's hard to pronounce.
All right, I'll do the honors. Eicosapentaenoic acid is EPA and docosahexaenoic acid is DHA.
So those are the ones that people will often see on supplement bottles.
Mm-hmm.
They'll see the EPA and DHA on a supplement bottle. And one of the things I'd always teach my patients was how to read that label. I know we're talking about food, but I just wanted to kind of jump into like this part of it because I think it does help to distinguish what they are in like a supplement at least. So when you look at a bottle of fish oil and it says 1,000 milligrams of fish oil, and then you look at the label on the back, it breaks it down into EPA and DHA. And those numbers, like I usually have the patient total that amount. And it could be like 300 milligrams of one and 200 milligrams of another. So you're basically getting 500 milligrams of those essential fatty acids in a capsule of 1,000 milligrams of fish oil.
Right. So there's some other oils in there that just aren't the omega-3s.
Right. Yeah. In general, like I think that's a good way of people kind of being like, oh, there are different kinds of omega-3 fatty acids. Mm-hmm. And what I find interesting, because like you said, that alpha-linolenic acid can be converted into these EPA and DHA. And men and women convert these differently. And then there are other genetic variabilities too that affect how our bodies convert them. So in general, men don't convert it as well as women. Women tend to have a higher conversion rate, and estrogen plays a role in that, which I thought was kind of cool.
So more estrogen means better conversion into the EPA, DHA.
Yeah. Mm-hmm. Yeah. So, and then, there are people who have genetic variability in the enzymes, the delta 6 and delta 5 desaturase enzymes that convert as well. So it's really important to eat these whole foods with the ALA, but it's a lot harder to get to the recommended doses of the EPA and DHA from eating those foods.
Right. So if you want a sure way to make sure that you're getting enough EPA or DHA would be to eat food sources of those, which cold water fish are probably the number one source.
Right. And for people who are allergic or don't eat fish or even are vegan, that poses a bit of a challenge. And so they usually go to the plant source. They go to the algae.
Mm-hmm. Yeah. And I think they're making some algae that intentionally are created to make more DHA in particular.
Oh, interesting. I did not know that. So Tina, where exactly are we getting our ALA from?
Well, the healthiest sources are whole nuts and seeds. I mean, especially things like the flax seeds that you already mentioned.
And they do need to be ground if you are a human and you're consuming them. That was the other thing I would tell my patients. They would be eating foods that had whole flax seeds. And I was like, you don't have a gizzard. You can't break that down. You can feed that to your chickens because they'll break it down, but we'll just poop them out. So freshly ground flaxseed.
Yes. Freshly ground flaxseed. Pumpkin seeds also. You can get pumpkin seeds when they're in season. You can save them if you're buying pumpkins for the family. And, pumpkin seeds are delicious.
Ooh, chia seeds.
Yeah. And you get some from other foods like soybeans. But I don't advocate for soybean oil, which is added in everything. But if people are eating, edamame, then great. You're going to get some ALA in that.
Oh, also green leafy vegetables.
Oh, sure.
Like dark green leafy vegetables.
Yeah, we actually talked about that in another episode.
Yeah, that's right. Oh, and then the part that I think surprises a lot of people is in the purely grass-fed animals.
Okay, here goes the first tangent. Here we go. Tangential warning. So, grass-fed beef and grass-fed animals in general, some people are turned off by them because they're too, quote unquote, gamey. The gaminess that people taste in meat, the fishiness we taste in fish, the flax oil that goes bad in the refrigerator because you haven't used it, all of it is the omega-3 fatty acids going bad. So fresh fish is not fishy. It's only fishy when it sits around. The oils will degrade eventually and become fishy. So fresh fish is not fishy per se because it's fresh. The omega-3 fatty acids are intact. It's the same thing with grass-fed beef and flaxseed. Even flax oil will go bad. So if you're in a part of the country where it's sat on the shelf and it's on sale because it's about to expire next month, it may go bad and it will smell nasty. All of these are the omega-3 fatty acids. They're extremely volatile and they go bad because they get oxidized. So when fatty acids get oxidized, they're stinky and nasty and you don't want to eat them.
So there are fish that even when they're fresh, they are fishier, and those would be the oily fish, I'm assuming, right? Like the cold water fish may have more than a lake fish. I guess lakes are cold too, but depends on your lake.
Yeah, I was going to say depends on the lake. But yeah, in general, sushi grade, right? Sushimi grade fish, when people eat fish raw in a Japanese restaurant, it's not super fishy, right?
They're usually pretty fresh. I mean, I get suspicious when it's the grocery store sushi where you're like, oh, that's a little fishy.
Right, because it's been sitting there. Surface area is exposed to oxygen, and as long as that's happening, it's starting to go bad.
Yeah, and that's typically why I don't recommend people taking things like flax oil, because it often can be rancid right off the shelf.
Yeah, and then people think that's what it tastes like. They don't know that it's oxidized. It's kind of like the grass-fed beef, or if it's game meat like venison. People are like, oh, that stuff's nasty because it's gamey. Well, if it's fresh enough, it won't be rancid oils that you're eating, so it won't be gamey.
Interesting. Mm-hmm. So why don't we take a break and we'll come back and talk about why exactly omega-3s are essential.
Yeah. How are they used in the body anyways?
Cool. Here's a hot tip for keeping ground flax seeds from going rancid. Store them in a container in your refrigerator or freezer. That keeps them fresher longer.
So let's talk about some things that these omega-3 fatty acids do in the body and why we need them.
Why they're essential.
Yeah, why they're essential. They're essential because our cells are made of what's called a bilipid layer. All the cells in the body.
Lipid being fat.
Right. And bilipid meaning there's two fatty acids that kind of point at each other.
I picture like the image, I'll put an image in the show notes, but I picture like the little heads on the outside and then the tails coming in.
Yes. You have the head on the outside and the tails coming in. So you have the hydrophilic and the hydrophobic parts of a fatty acid. And the hydrophilic parts point towards the inside of the cell and the outside of the cell. And the hydrophobic parts point towards each other. And that's the tail.
And the hydrophilic and hydrophobic just means like water loving or water hating. It's fearing. Phobic would be fearing, right?
Yeah, it is fearing.
So it's just how it reacts. I mean, think about like when you drop a drop of oil into water and how it comes together, right?
Right. So a cell membrane has this bilipid layer or two fatty acid layers, and there's all different types of fatty acids I'm finding this a little challenging to.
Well, you're using your hands. I'm seeing you use your hands, right? Like to show the tails, and it's hard when there's no video.
This is a podcast, so I know that people do not see my hands right now. It's very clear if you saw my hands. Anyways, all you really need to know is the fatty acids are a variety of types of fatty acids, and you need a certain amount of these omega-3 fatty acids that are very fluid to be incorporated into the cell membrane. So what you want in a good cell membrane is fluidity. You want it to be able to move around. It's not static. So you have all sorts of channels and receptors and sugar molecules hanging off of it, but they're not sitting still. They're moving at all times. And that movement is integral to good, proper, robust cellular function so that it reacts to its outside and it communicates with other cells in the immune system. And interiorly, it also functions normally because the cell membrane allows things to get through. Those receptors and channels are functioning properly, and it keeps out other things that shouldn't be going through the cell, right? So fluidity is the key to a good cell function, which is interesting, right? Because resilience is the key to health in general. Resilient cells are made with some omega-3 fatty acids incorporated into their membranes.
Yeah. So I always think of it as the cell is less stiff, and nutrients and information, everything that needs to come in and out of the cell can do so with the omega-3s incorporated into it. So I think of like a blood cell, right? Because you need omega-3s to incorporate into your blood cells, and it allows them to be more fluid. And then the blood itself is more fluid. That's kind of a really simplistic way of, how I usually describe it to patients.
Yeah, and you can think of fluidity as a literal term with the oil on your counter too, right? So saturated fats aren't fluid. You're talking about butter, you're talking about lard, coconut oil. I mean, they solidify at room temperature. Depending where you live, coconut oil could be fluid or not fluid. In any case, these polyunsaturated fatty acids, PUFAs, omega-3 is a polyunsaturated fatty acid, are more fluid in general. Omega-3 fatty acids can be put into the freezer and they still won't freeze. So they're that fluid. They just don't solidify. And it's the same for your cells. The fluidity is preserved with these polyunsaturated fatty acids. So the cell membrane function all around needs to have a certain amount in there. And when you have enough of these omega-3 fatty acids incorporated into your membranes of your cells, you have a more anti-inflammatory tendency when your cell goes to break down some of that cell membrane. This is part of what happens all the time. We have enzymes that go up, grab those little fatty acids from the membrane and break them down. And if you have very little omega-3 fatty acids incorporated, that whole process is going to lead to more inflammation. If you have a good amount of omega-3 fatty acids incorporated, that same enzyme goes up, pulls down an omega-3 fatty acid, and the net effect of breaking down that particular type of fatty acid is anti-inflammatory. So this is one of the reasons we say omega-3 fatty acids are anti-inflammatory, because naturally, if you have enough of them, your body will tend towards less inflammation. In the same vein, on the anti-inflammatory effects, the omega-3 fatty acids can also become resolvins. And resolvins are a whole class of compounds that we make to resolve inflammation. Because inflammation is necessary. We have to have inflammation. We won't heal from a cut or get over a flu. You have to resolve the inflammation and keep it from becoming chronic.
I like that name, resolvins.
Nice and simple, right?
Yeah.
I guess the last thing I should mention is that fatty acids are also, by virtue of being these long chains of carbon, they are taken up into cells and we make energy from them. So fatty acids are used to make energy within the cell. So they're a source of energy. Just like glucose is a source of energy for cells, fatty acids can be a source of energy for the cells. In particular, the mitochondria is where that's produced.
So you mentioned that fatty acids are made up of carbon. So did you want to kind of touch on why they're called omega-3 fatty acids?
Oh, yeah. I don't want to get into too much detail, but when you have an unsaturated fatty acid, you have what are called double bonds between the carbons. Where those double bonds occur has to do with calling it omega-3 fatty acid. Omega just has to do with a site on the chain.
Okay. I'm trying to think of like specific things as to like where omega-3s are beneficial in the body. And because of their importance in, the cell itself, it's pretty much everywhere because we're made up of cells, right? We're a collection of cells. And so it's our eyes, our brains, the developing brain. You think about how pregnant women, their supplements contain DHA, and how infant formulas contain DHA, like these are omega-3s. It's important for the nervous system. It's important for our skin. It helps with everything. I just kind of like trying to think about like, what doesn't it benefit?
Right.
They're part of our cells. And so they're part of every single part of our body.
Right. So adequate amounts is essential for just good overall health for all systems.
Right. And I think it's really rare to have an overt deficiency. I'm sure in a lot of malabsorption cases or malnutrition, there would be more of an actual deficiency. And that's why when patients get TPN, they get, the nutrition through their port, that has omega-3 fatty acids in it, right? As do the nutritional drinks that people buy.
So maybe the one The one group that we do need to mention is anyone who has trouble absorbing fats in general.
Right.
They're not going to have selective absorption troubles with this particular fat, but if someone has trouble because they have trouble with their pancreatic function, so there's less lipase, or there's trouble, or they don't even have their gallbladder, gallbladder has been removed for whatever reason, and there's less bile acids, there's going to be a little more trouble absorbing fats in general.
Right. Or any surgery, because those fats are absorbed in the small intestine. Mm-hmm. And so any surgery that affects that. So I think that's a really good time to kind of move on to why omega-3s are important for cancer patients and cancer survivors.
Yeah. So let's break it down. We'll talk about prevention, like primary prevention of cancer in general, and then during treatment time, and then after cancer treatment.
Right. Survivorship. Yeah. Okay.
Did you know that of all the nuts and seeds, chia seeds have the highest concentration of omega-3 fatty acids? In fact, the word chia is derived from an ancient Aztec word meaning oily. So one of the things that we know is when there is a systemic chronic inflammatory state for a long period of time, that's not good for health. And it seems, although nothing is conclusive, but it does seem that high inflammatory states, systemic high inflammation, is a risk factor for various types of cancer. And we know this because CRP, or C-reactive protein, is one way to test that. And high CRP has been associated with many, many different cancers. Cause and effect are a little bit overlapping because once cancer is present, the CRP can go up just because cancer creates these inflammatory compounds, including that CRP, which is just a marker of systemic inflammation. But in general, anything that dampens inflammation and keeps people in more of a balanced state between inflammation and anti-inflammation states is going to be preventative. I think the research is strongest in cancers like colorectal cancer.
Right, for risk reduction. I don't like, you know me, I don't like the word prevention.
I know, because people promise it, right?
I know yeah. And when you have a patient who's like, I did all the right things, I ate all the right foods, and they still get cancer, it's like, we talk about risk reduction here.
Yeah, I know. I don't really like the word prevention either. It's still used in the headlines, and it's an overpromise to say you can prevent it. We can reduce your risk of it happening. Right. But you can't prevent.
But yeah, so colon cancer has been one of the cancers that has been looked at with omega-3 fatty acids and risk reduction.
Yeah. So of course that overlaps with where are they getting it and how are their diets in general. In other words, if they're eating more nuts and seeds or they're eating more cold water fish, then there's more happening than just omega-3 fatty acids nutritionally. So like always, observational studies that show trends in any consumption of a food and an outcome are just that. They're trends, and they're what we call hypothesis generating. They're not proof of anything.
Because it's hard to control when it's in a diet because the diet is so complex.
Yeah. So the only way to really know is to take a bunch of people over a long period of time, give them a supplement, and then have a placebo group and see what the rates of cancer
and have
are.
them have the exact same diets as well, right? I mean,
yeah. So that's
which is like really hard to do.
Not likely. Yeah. So as far as risk reduction, we have trends that show that it may be beneficial, but we don't have anything conclusive.
Okay. So then what about during treatment? The majority of my patients who show up with their, bag of supplements, they have some sort of fish oil, some sort of omega-3. They might have krill oil even, like they have something because they're taking it for their heart, their cardiologist recommended it, or whatever it may be, their primary care recommended it for their eczema.
Yeah. And so during treatment, whether it's chemotherapy, well, let's just take like a chemotherapy first. Let's divide this out a little bit. So it depends on the drug, first of all. So there's evidence that omega-3 fatty acids, fish oil in particular, may lessen neuropathy in some chemotherapies, like the taxane-based, that paclitaxel and docetaxel.
And again, we're going to say reduce the risk, because as a person, I'm bringing it back to me, as the person who took omega-3 fatty acids during their taxane, you're reducing a risk of something you're not going to guarantee anything.
Right. Never.
And I also ate a lot of omega-3, rich foods during treatment. So, I was getting it from all sources.
Yeah, and that was one study that was back in 2012 on the taxanes, and it used the word protective. It said something like omega-3 fatty acids are protective against paclitaxel-induced neuropathy or something like that. In any case, there was a trial using omega-3 fatty acids and looking at peripheral neuropathy induced by oxaliplatin, and it reduced the risk of that for these folks who took it. The irony of that, of course, is there's a whole nother mouse study that said, don't take fish oils alongside a platinum drug. So,
Right. I know. That's like in the back of my mind too.
yeah, that was a mouse study. I'm not so sure it's all that relevant for what we do when you have a human trial showing that there could be benefit rather than, any problem with it.
And I mean, it was a form of an omega-3 fatty acid that I don't remember actually seeing. I think we actually contacted the suppliers of the fish oils that we, had at the cancer center, and they did not find that form in any of the supplements.
The form that created resistance in the mice to the drug, the platinum-based drugs.
Yeah.
Mm-hmm.
So, but that did make a lot of headlines.
Yeah. The other common use during treatment is if someone has trouble with weight loss, actual trouble keeping their weight on, whether it's muscle loss or overall weight loss, we'll do higher doses of fish oil to try to maintain that.
Right. And yeah, like I mentioned before, it is in TPN formulas, it's in tube feedings, all of those. It's, it is important for helping patients to maintain muscle and to maintain weight.
Yeah. And some of that has to do, yes, it has calories in and of itself, but it's also its anti-inflammatory effect, because at some point, especially if someone is in kind of that spiral of cachexia, then that is an inflammatory process in and of itself. So fish oil can counter that. And we use fish oil in higher doses for that during treatment.
Yeah, I think there was a study that looked at specifically the EPA.
Mm-hmm.
It was like 2.2 grams of EPA itself. And so again, looking back at that nutritional label, it's not 2.5 fish oil capsules. It's taking that number on the back of the label and adding it up until you get to that amount. And I mean, that gets to a lot of capsules. Sometimes people do liquid, but that's why getting it from a bunch of different sources is important.
Yeah. So that's kind of the chemo evidence that I know of. Do you know of any other for chemo?
I know that I'd seen something about it reduces dry mouth, and I'm not sure specifically what that pertained to, but it apparently is something that reduced xerostomia. But yeah, I can't think of anything else specific to chemo.
Okay. And then separately, we have surgery, which is very common, right?
Right. And surgery is super controversial. There is a lot of information out there that omega-3 fatty acids help with healing. Again, it's in those formulas. It's in Impact AS, which is a supplement drink that is sometimes recommended to patients before they go into specific surgeries, typically like I think bowel surgeries, GI surgeries. And it does have a pretty decent amount of omega-3s in there. Mm-hmm. So there is information out there showing that it is very helpful in terms of recovery time. But then classically, you're heard stop all supplements, especially anything like fish oil, because it may cause bleeding during surgery.
Yeah, and I do think that there was a decent paper within the last couple of years that has disproven that. I think it's been put to some tests, and there's no good evidence to show that fish oil increases bleeding.
Right.
That said, I will say most of my patients have to give up everything but absolutely necessary medications for a week before surgery anyways, no matter what it is.
Right. And I encourage patients to do that too, but there still are foods that you can consume, right? I mean,
right.
You're still eating those green leafy vegetables, which help because you've got all those other nutrients that support around surgery. You've got your vitamin A and, you've got your omegas. And so for patients that are really concerned about that, like, I don't want to stop taking my fish oil, just encourage them to, eat foods.
Yeah. And remember that it's incorporated into the cell membranes. So that's not going to go away in 1 week for most of the tissues in the body. Most of the tissues in the body are not turning over every week. They take longer. So you're still going in with omega-3 fatty acid repletion into the surgery, which does bode well because not having enough makes it harder to recover. Surgery itself is an inflammatory event.
And what about radiation? That's next, right? Do you typically have patients hold any sort of omega-3 supplements during radiation?
No, no,
Okay.
I do not. No, because remember, I mean, I always think of radiation as damaging cells through oxidation. So anything that makes them more vulnerable to that. So there was, gosh, it's a long time ago now, 2012, 2013, a long time ago. There was an interesting study that came out where they gave people with lung cancer who were going in to get radiation, they gave them 2 grams of DHA, but they only did it for 7 days before they went in. So they basically loaded them up with DHA. And these were people with a particular type of lung cancer that's fairly rapidly dividing. So the cancer cells incorporated the DHA rather quickly because the cell membranes on a cancer cell look a lot like any other cell in the body. So they're just going to use what fatty acids are available, and they're going to incorporate whatever's available. So if you have a lot of DHA circulating, it will incorporate more DHA than otherwise. What that did, it made the cells more vulnerable to the radiation. So the radiation was more effective in these people because when you incorporate more DHA, it becomes easier to oxidize, just like it does on your counter, right? So I mentioned earlier that omega-3 fatty acids oxidize easily. They go rancid easily. It's the same thing when they're in your body. For radiation, that's a good thing because radiation kills cells via oxidation. So from that time on, I often, when people were getting radiation, I would have them do a large dose of DHA, but only for a week before. Because what you don't want is all of the cells of the body to be flooded with DHA. You really only want the cancer cells so that you have kind of a more specific end result. So the radiation affects those cells specifically. Surrounding cells aren't dividing as quickly, so they won't, they're not undergoing mitosis as quickly and they're not turning over as quickly. So the idea here is that you do a large dose for a short period of time just before an oxidative process like radiation. I just thought it was a neat little study. And I think since then, there has been one other study where I saw kind of the same premise used, and I don't recall it as much detail. The lung cancer one I wrote up myself, a summary on it, so it sticks in my head a little bit better.
Yeah, I don't know if I was familiar with that study. That's kind of interesting.
I will have them hold other things that are highly antioxidative during radiation. So I will have people, let their Vitamixer get dusty or their juicer because I don't really want them doing a lot of antioxidant, actions within the cells. And that's what all those green shakes and things do.
That's a whole nother episode.
I know. It's along the same lines, though. And you want to be vulnerable to oxidation during radiation, just for that short time. I mean, hopefully it's a short time of days or weeks.
So then following treatment, omega-3 fatty acids. I think they're great. I think they're like really important because treatment causes effects obviously with hair, whether it's hair loss or thinning or just change in texture, like brittleness, nails, same thing. Sometimes there's nail loss and sometimes there's just brittleness, skin. I mean, just kind of like every part of you feels dry after treatment. And so I see like incorporating more omega-3s as a great way of, before working with cancer patients, we used to talk about, taking your fish oil because you're like moisturizing from the inside out. That was kind of like the little catchphrase that we'd say. And that's what I think of it, just re-lubricating all of that dryness that happens all over from treatment.
Yeah, because there's a rapid repair process when you're recovering right after treatment, especially, right? There's that usually somewhere between 12 and 18 months where you're getting back to a semblance of your pre-treatment self as far as your cells and organ systems go. So I think of that as an intensive recovery time. And then thereafter, I mean, there is studies showing that adequate fish oil intake, it's not high doses. This isn't like mega dosing fish oil or anything like that, but adequate intake of omega-3 fatty acids and fish oil in particular was associated with less recurrence in breast cancer, for example. So not surprising. I don't think the recommendations are a whole lot different than you would do before you had cancer. You just want to make sure you have adequate amounts for all systems, all cells, not necessarily high doses for any particular reason that I can think of. The one cancer that has controversy is prostate cancer. I don't think the controversy is all that warranted, but there is conflicting data for prostate cancer. Some studies show that it was associated with more aggressive prostate cancer or higher risk of prostate cancer, and other studies show that it was the opposite, that it actually protected. And I think a lot of these are confusing because it's apples and oranges. They're looking at fish consumption in some. They're not even testing blood levels in some of them. I mean, they're extrapolating the conclusion is that it has to do with omega-3 fatty acids, but there's no proof of that. It could just be they're eating contaminated fish from lakes that are nasty. I don't know. There's all sorts of reasons that.
I mean, yeah, it's that time when those studies came out, that was really confusing.
Yeah.
Because there is so much conflicting data. Another benefit of omega-3 fatty acids for cancer survivors would be, just cardiovascular health in general. So many of the treatments can be detrimental to the heart, right? And so eating those omega-3 rich foods could potentially benefit in terms of reducing, risk of any sort of cardiovascular events, even in terms of triglycerides, right? Some of the treatments can result in cholesterol abnormalities. And so whether it's supplementation or through foods, just increasing those in the diet can help with lowering triglycerides.
Yeah, that's a nice thing about a lot of things we talk about cancer, because we are the cancer pod, but everything we talk about really is relevant across the board. Is like, having adequate fatty acids, having a low systemic inflammatory state is both reducing risk of recurrence and helping your other systems, your brain and your heart and your lungs and everything function better.
Yeah. And I think that's one place like in survivorship where, people kind of feel, I don't want to say, it's a kick to the curb. I mean, they kind of feel like, you're done with treatment, just go about your life. But there still are things that can be done to not only reduce the risk of a cancer recurrence, but also reducing the risk of the collateral damage that happens, or lessening the effects of the collateral damage. And so that's why, I think that's kind of part of why we're here.
I agree. There's a lot more that can be done all the time.
All right. And we kind of touched on some of the contraindications, but maybe we take a break and come back and then talk about a few more contraindications and then wrap things up after that.
All right. See you on the other side.
Did you know 1 3.5-ounce serving of salmon, anchovies, or herring has over 2,000 milligrams of omega-3s? Other great seafood sources include mackerel, sardines, albacore tuna, shellfish like mussels and oysters, even caviar. So we had already mentioned about contraindications with fish oil, omega-3s, as a supplement. And that would be the potential interaction with the efficacy of platinums, chemotherapy. And then also there are mixed studies about prostate cancer and fish oil. And then surgery. I mean, there are some surgeons who are like, absolutely no, but there's new data out there that, shows otherwise. So there definitely are medications that may interact with supplementation, warfarin, anything with bleeding. I guess that would be a big contraindication just in general. If there's any risk of bleeding, any disorder that might predispose someone to bleeding, I would say that would be a contraindication. And so that includes things like warfarin.
Contraindication for taking a higher dose in a supplement.
For taking higher dose supplement, right? Not necessarily for, eating foods with the omega-3 fatty acids, but yeah, for taking supplements. So the other one, the glucocorticoids, is the other medication where there might be interactions. And then there are some labs. So where someone may be taking omega-3 fatty acid supplements to lower their triglycerides, it may also increase their LDL levels. So that would be a bit of a surprise. I don't see it as being necessarily a bad thing. The LDL levels are increasing because you're taking in more fat. It just would be a healthier fat. So that's just something to kind of look out for.
Okay. Otherwise, there's not a lot of contraindications for it. Generally, especially if you're getting it from food, there is none.
Right. Yeah. The contraindications come with the supplementation when people take very high doses. I'm not aware of any contraindications when it's in your diet.
Right. Oh, I should mention the other thing. It's not a contraindication, but it's something to keep in mind is that really high levels may be immune suppressive. So when people are doing these really high levels, like 5 grams a day, 6 grams a day and more, it may not support the immune system. It may actually be immune suppressive at that point.
Oh, that does bring me to a contraindication then. That brings me to the use of omega-3 fatty acids and the immune checkpoint inhibitors.
So these are the PD-1.
PD-L1s. Yeah, PD-1, PD-L1.
Just for the general public, if anyone watches the nightly news, these are the commercials you see for Opdivo or Keytruda.
Right. Or Or for ipilimumab. Yeah. So Yervoy, so much easier to say.
I know.
And so, yeah. So when I was in my residency, the cancer center where I was working they were part of the trials for IPI. And because patients have to hold supplements during clinical trials, we were looking through to see the effects of what this immunotherapy does. And that's when we kind of realized the effect that omega-3 fatty acids could have. And so we definitely held that with the patients. And that was really important because of the potential for effect. So that would be, that escaped me? But yeah, that's the therapy that I do think of.
Okay. All right. Is there anything else that we have forgotten to mention?
Yeah, you know what? Supplementation wise, I do want to mention that, there are some side effects with taking an omega-3 supplement, and they're usually like gastrointestinal, right? It's like the burping of the fish oil. If you take too much, you can get loose stool or diarrhea because it's a fat. So if you're having issues, like we mentioned before, if you're having issues with absorbing fats in general, you'll have problems absorbing fish oil. And then that kind of burping up the fish oil, it can like cause nausea as well. I do recommend for patients who are taking fish oil, you can keep the bottle in your freezer and then take your capsules, as needed, just taking them out of the freezer, because freezing it will kind of keep that fishiness down until it gets into your stomach. Just don't chase it with something like hot tea or coffee, because then that will break apart the capsule. And then also look for enteric coated capsules, because that also kind of keeps it all together until it gets to where it needs to be.
Yeah. And, at least half, if not more, of my patients chose to do it as a bulk oil and not even do the gel cap.
Oh, as liquid?
Yeah. Often they would just add it to something they were already doing. Like if they were already doing a green drink, if they were doing a smoothie, they would get one. And if it's fresh, it shouldn't be fishy. And it is probably the freshest way to get these fatty acids, because there's no process. When you put a gel cap together, you have to melt those two pieces, the gel cap together around the fish oil. If you take a needle and you poke that, or a push pin is easier, and you poke that and you taste it, smell it, whatever, it's going to be fishier than anything you buy in bulk, because what they did with the bulk oil, that bulk oil has never seen oxygen. And then they put it in the bottle and they'll put nitrogen on top even. So even that little bit of air in the bottle is nitrogen, so that the fish oil stays fresh. So for those who are willing and able to do a bulk oil, that probably is quality wise a better guarantee, as long as it's a company that, sells high quality fish oil.
Yeah. And I actually used to do that. I would put a spoonful of it in my blueberry smoothie. And it's funny because like initially you don't taste it, but don't set that smoothie on your desk and sip it slowly throughout the day, because it will start to get fishy.
Yeah. Well, and the other nice thing about that is if people are doing something like cod liver oil, it has other nutrients in there that are good for prevention of recurrence, like vitamin A and vitamin D. So,
right. And that's actually would be kind of a caution with some of those brands, is that having too high doses of vitamin A, or vitamin D in it. So that's, again, trying to find a brand that is very forthcoming about how much of those other nutrients are in there is a good thing to look for.
And if you have a bottle and you open it and it's fresh, it is not fishy.
Speaking of cod liver oil, I think that's a great segue to talk about our song.
Okay, I'm going to say you gave me a little clip of this song and I was impressed. This is fairly obscure.
Yeah, so it's a song that is called Cod Liver Oil, and it is a traditional ballad, and it's from Newfoundland. And there are a bunch of artists who've covered it. And so I'll put one of the versions that I find. I'll put that up on Spotify, and we'll put the video on the website as well.
So can I give away the gist of it though?
Yeah.
I mean, it was basically talking about how this woman is depressed until she does her cod liver oil and then she snaps out of it, right?
Yeah, because cod liver oil has for centuries been used as sort of like traditional medicine, right?
Yeah, I thought that's the best part. It's not just it doesn't just refer to cod liver oil, but it actually refers to a fairly, to me, naturopathic way of using it, right? Like, this is something we do.
Yeah, because it's this man who's singing about his wife who's taken ill. And yeah, so that's the song. I thought it was kind of fun.
That's a good one.
I guess that's it.
Yeah.
We survived our first dive into supplements. There's so much more that we could talk about. I mean, I'm just sitting here thinking about other things that we didn't mention, but we'll come back to it in our live, and then I'll try to do some posts as well, kind of delving into a little bit more information. But yeah, thanks for tuning in. And as always, you can find us on social media, on Instagram and Twitter and Facebook.
Yeah. And if you like this podcast, please share it with people who you think it might help, because ultimately that's what we want. We want this to grow organically in a way that helps other people as best we can through audio.
We're not buying followers out there. No, we want people who could benefit from this information to hear it. So if you like what you hear, leave a comment on whatever streaming site you listen to us. And yeah, I guess that's it. So on that note, I'm Dr. Leah Sherman.
And I'm Dr. Tina Kaiser.
And this is the Cancer Pod.
Until next time.
Thanks for listening to the Cancer Pod. Remember to subscribe, review, and rate us wherever you get your podcasts. Follow us on social media for updates. And as always, this is not medical advice. These are our opinions. Talk to your doctor before changing anything related to your treatment plan. The Cancer Pod is hosted by me, Dr. Leah Sherman, and by Dr. Tina Kaiser. Music is by Kevin MacLeod. See you next time. Other great seafood sources include mackerel, sardines, albacore tuna, shellfish like mustards.